My name's Ernie Alessandro. I live in Travelers Rest. I moved here from Georgia, and I'm an electrician. 2019, I ended up in the hospital with congestive heart failure. I started seeing Dr. Gettys after that regularly, and then I don't think I saw him for a while, and then all of a sudden I had a motorcycle wreck. I was out of work for 4 months. They found something on one of my MRIs. They found out I had to have back surgery, and they told me that they thought I had cancer. When I went and saw Dr. Gettys, he calmed me down, told me right now it's just a mass, they don't know. That's the day he prayed with me. And when I walked out of there, I had new respect for him, man. I couldn't get released for I had to have back surgery. Then they did the radiation, and every day I was getting worse. I couldn't even make it to the living room. And I had a doctor's appointment with Dr. Gettys on Friday.
Ernie had come in the mid-afternoon on the day he had his appointment scheduled with a chief complaint of some shoulder pain. I'd known Ernie for years. He'd been a patient of mine and had gone through the ups and downs of healthcare issues with him over the years. When he came through the door, I recognized he did not look well at all. He was very pale, he was breathing hard, his wife was with him, and she also was looking anxious. Took a look at his vital signs, and I noticed that he had some abnormal blood pressure, his oxygen level was very low. So he started talking, and he was saying, I'm not sure what's wrong, I just feel really bad, I'm really breathless. And his fingers were really, really blue. So again, had my medical assistant check his oxygen. It had come up to normal. I thought, well, that's odd. So I had her walk him around the office to see what happened, and it dropped precipitously from the mid-90s, which is normal, down into the mid-50s, which is clearly not normal. Knowing about this serious underlying health condition, which he'd recently had operated on, I started thinking, well, is this guy having an infection from his surgery? Could he be having a blood clot into his lung? That was kind of highest on my list. Nonetheless, did some laboratory investigation, did a chest x-ray. That all looked clear. It was obvious to me this guy needed further care than we could provide in this office. I reached out to the local hospitalist group who helps with hospital admissions. We had him able to be directly admitted at the hospital rather than go through another investigation in the emergency department, which in my mind would have been redundant. Unfortunately, he did indeed have a blood clot in his lung, likely as a consequence of this coincidental underlying health condition, but was there nonetheless. So had he not come for care, he most certainly would have died. He was able to get stabilized, receive the treatment he needed, and thankfully has done exceptionally well and is likely to go on to live a long, healthy life.
If Dr. Gettys wasn't my doctor, I wouldn't have been going to the doctor that day. It makes a difference that he's my doctor, because when I know I don't feel good or I know that something's wrong, I know he cares about me. Because I went from my arm being sore from the motorcycle wreck. I would have just shrugged it off and kept going. But he's my doctor. He's the one that's supposed to take care of me. And because I've been going to him so long, it's more personal. He's been in my life, Everybody in my family knows his name.
I think, and I know my partners feel like our patients are family. Having a long-term relationship with Ernie has been enjoyable for me. I think we have a great personal relationship together, and I believe that helps me to help craft a treatment plan for him that's ultimately going to help him be as successful as he can be. Prisma Health is a large system, but with that size and footprint comes tremendous resources. Having the integrated network, the relationships that we have with our hospitalist colleagues, emergency room physicians, and other specialists is invaluable. In fact, life-saving in this case.
If you take the time to get a doctor, build a relationship, everything in life is built on relationships. Doctors is important. If I don't feel good, I know I got a doctor that cares about me. It's worth more than you know.